Parks, Barnett, Blackwell, Blunt, Boyd, DeBar, England, Fillingane, Frazier, Harkins, Hickman, Hill, Hobson, McMahon, Tate,
Here.
Turner Ford, Wiggins. We have a quorum.
The first item I'm going to call up is House Bill 1622. Senator Johnson moves title sufficient to pass and offers a strike all amendment. And I believe you have copies of that strike all on 1622 before you. Just as a matter of housekeeping, there are three changes which are technical in nature. I'm going to ask unanimous consent to make those changes. One is to change the word may to shall on line 64. Another is to make certain on line 1640 or thereabouts that provision begins to take effect on July 1st, 2026. And then on it's hiding on the back side of a piece of paper on line 106 to make it clear that if a hospital is not awarded the exemption for dialysis, that they could reapply for another exemption. Without objection, I'm just going to have the draftsman make those three technical corrections. This is a pilot program for hospitals in small communities. I believe you have in your material a list of the hospitals that we're talking about. There have been discussions about certificates of need and what to do about small hospitals going on for quite some time. I've had a good bit of discussion with my counterpart in the House about that. And the House has a bill very similar to what is before us. I would say that the similarities between the two bills in terms of what we actually do are probably greater than 90%. And it's because of our continuing interaction. I was thinking that part of what happens in these jobs we have is that people come up to us and make arguments for and against various bills and proposals, and they all say things which are plausible, but we don't have any really method of finding out which way's up. Hence the notion that we would have a pilot project to exempt on a limited basis some hospitals from certificates of need, simply to see what would happen if this group of small community hospitals had an ability to get one certificate of need for one service. So that's what the bill does. It defines the same group of hospitals. I think there are 55 of them that have been consistent in the most recent iterations of bills between the House and the Senate. The Senate bill says that any of these 55 can, without getting a certificate of need, open a geriatric psychiatric unit. It also says that each of the hospitals may, without getting a certificate of need, get one exemption from CON for a service that would otherwise require a certificate of need. We have certain things that are under moratorium, including, for example, nursing homes. So you would not be able to get matters which are under moratoriums. And it would also limit to 8 the number of hospitals that could get dialysis units. One of the concerns that was expressed about an earlier version of the bill was discretion that the state health officer would have. I don't think this bill gives the state health officer any discretion. I think the state health officer would be doing essentially making sure that the applications were technically within the statute, but I don't think that there's any discretion there. So that is where it is. It says that the applications must be made on or before of July 1st of next year. Our idea is if we're going to have pilots, we want these pilots on the boats, we want the boats underway and making way. We don't want the pilots sitting there on the shore waiting to get the boat started, literally and genuinely, so we can see what happens when we do this. This is the first section of the bill, which is the core of the bill. There are three other provisions. Section 2 of the bill is an attempt to, find it here, reinstitute the moratoriums that we now have or continue them in effect. As you know, there's been some litigation about the various moratoriums we have. This finds that the moratoriums should continue, but importantly, it says that on or before December 1st of next year, and on or before December 1st of each second year thereafter, the State Department of Health should tell us, and should the moratoriums continue or not, or where do we stand? I think that would be a better view of the moratorium that we have. Section 3 is a provision that the House has included in their bill, which is important to them. I apologize for the length of this. That's just sort of how this section works. Do you know where the new language is about that? See, I was all the way over on page 60. I'm told it's on page 57. It says that if you wish to conduct anything in Issaquena or Humphreys County that would otherwise require a CON, except for certain subsections, you can put a facility in Issaquena or Humphreys County. I think all things considered, it's unlikely anything would actually be located there, but maybe we'll find out. The other provision is in section 4, which is a loser pay provision. It applies only to court actions if after, and this is for all CONs, not merely the ones that we're concerned with here. If on or after July 1st, you go to court to overturn a decision of a state health officer about CONs and you lose, you'd be responsible for the reasonable cost and fees of the prevailing party. So that's what the bill does. I'll be happy to entertain questions. If there are no questions, are you ready to vote? Vote occurs on the strike all amendment by Senator Johnson. All in favor say aye. All opposed, no. The ayes appear to have it. The vote then occurs on title sufficient do pass as amended. All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. I will assure the committee, so far as I know, there are no snakes here, and I do not intend to take this bill up tomorrow. And I've looked for snakes. I've tried to find a mongoose. But, at this point, I think we should take up House Bill 942, which is the chiropractors regulation. Senator McMahon, there he is. Senator McMahon moves title sufficient do pass, and Senator Mann offers an amendment. And Senator McMahon, you're recognized to explain your amendment.
Thank you. Thank you, Mr. Chairman. I've had the amendment printed for each of the senators. Want to give everyone an opportunity to get a copy of that. what I'm basically asking for is your help today. Consider this almost like a local and private. Mississippi is fortunate. We have a neurologic chiropractor. It's my understanding we only have one in the state, and they are located in Lee County, Mississippi. And he's a world renowned. He's written several books. And in addition to that, he was invited this year to appear on TEDx. Now, as each of you know, in your own field, you don't get invited to a TEDx event without being recognized as a leader, an expert within your industry. And so what this bill would do, this is not a scope of practice, this is an advertising. This will allow him to advertise in his own home county that he is a neurologic chiropractor and holds the advanced degrees and certifications for that. And that's what the amendment does. I would yield for any questions.
Questions on the amendment? Senator Blackwell.
Thank you, Mr. Chairman. I've received several emails about this proposed amendment. And as I look at it, I'm not sure it's germane to the bill. Can I get council's guidance on that? Because the bill is talking about veterinarian chiropractors.
I'd like to speak to that. The bill before us, I'm sorry,
Senator McMahon.
Chairman, thank you. The bill before us extends the repealer for the licensure law for the chiropractors board. And this is a bill that would be notwithstanding that board that would allow him to advertise as a neurologic chiropractor. So that's my position, but I yield to the chair and to council.
Yeah.
I have 4 copies of the amendment. Okay. It's a new section. I think if we've got the entire law about chiropractic examiners before us, that I'm, at least for present purposes, going to rule the amendment germane. If we wind up on the floor may take a different view of that, but at least tentatively, I'll rule that the amendment is germane.
Again, before we vote, I would like to say this is only deals with Lee County, Mississippi only. It is not a scope of practice. It only allows somebody to advertise.
I think Senator Wiggins has been seeking recognition. Senator Wiggins.
Thank you, Mr. Chairman. Senator McMahon, I appreciate what you're trying to do. However, in my research and from reading, I don't know that chiropractic neurology is even a profession. Can you weigh in on that?
I can. It actually addresses, there are two accreditation licensures in this country, and one of them is the American Chiropractic Neurology Board, and the other is the International Board of Chiropractic Neurology.
Okay, what about this person you're talking about? I've been informed that he's been disciplined no less than 3 times by the board of the chiropractic board. And they have sanctioned him, and he's refused to continue to abide by what the chiropractic board has told him. And part of it is the advertising as a neurologist, which they have said violates their board.
Part of the governing board, it's been their opinion that they don't recognize this cutting edge chiropractic discipline. But I want you to imagine, Senator Wiggins, for yourself as an attorney. Imagine if you were specializing in a particular law, and you were invited to come and speak at a worldwide event for TEDx as an expert in that field. And then you get home and you're censured by the Mississippi Bar Association.
So the answer to my question is he has been censured by the Mississippi Chiropractic Association.
It's my understanding there were multiple attempts made, and after they made multiple attempts, they finally were able to find a reason to discipline him.
Okay, so in other words, this is the Public Health Committee and we have various boards to
Correct.
regulate the health and welfare of the community. The board that we've empowered has sanctioned him for doing that. And now with this amendment, we're trying to bypass them so that he can advertise in something that's not recognized by the board.
It's only an advertising to recognize his credentials.
But the in the actual bill, there's a certain, it limits what you can have behind your name, just like
I
the
understand
medical
that.
practice has MD,
I understand.
the lawyers have whatever, JD. So is it? So in other words, the law doesn't allow that, but he's wanting to be able to go out and add something new that nobody else is allowed to do in Mississippi.
Well, anybody with these credentials would be able to do it if you wanted to make it statewide, but since there's only one in the state, I was going to try to target it almost to just one county. I hope you can support the amendment, Senator.
I certainly appreciate you trying to represent your constituent, but I think as a number of members, the problem is he's been disciplined a number of times by the board.
He's been disciplined. They've attempted to discipline him multiple times and finally found a way to discipline him one time.
And you know, there's an old saying, every prisoner who's behind bars thinks they're innocent.
Aren't they? All your clients were innocent, weren't they?
No comment.
I move for, and look,
no,
the amendment is
no-
what it is.
no further
Listen,
questions.
the amendment is what it is. If you can support me, you can. If you can't, I
And I
understand.
appreciate your candor.
Yes, sir. Yes, sir. And so, I move for adoption of the amendment.
As best I can tell, Senator Tate is telling me Senator Hill wishes to speak. Senator Hill, is that correct?
Correct. I just have a question for Senator McMahon. This is new to me, Senator McMahon, but it looks to me like that there is a legitimate program for chiropractic neurology and a licensure exam, training programs, even says 300 hours in functional neurology for licensed chiropractors to specialize in diagnosing and treating neurological disorders. So what our problem here appears to be that because Mississippi doesn't recognize it, regardless if you're trained in it, you can't say that you're trained in it. Is that correct?
That is my understanding. And, I would hate for this person to move out of state and move to a state where it is recognized and set up his practice in a different state. When he wants to do business in Mississippi, he can do business in Mississippi. And, I hope you will support the amendment, Senator.
Maybe this is something that the Occupational Licensing Review Committee may need to look into.
I'm sure it's going to be elevated, regardless of what happens here, I think it's going to be, reviewed.
Could even be a First Amendment case. I don't know. I'm not a constitutional lawyer, but I think I see the problem. Thank you.
Thank you, Senator.
Senator Hill, when you say you're not a constitutional lawyer, that leaves open the sort of negative implication that you are some other variety of lawyer. There's something you've been keeping from us. That's just osmosis. You're hanging around with a bad crowd, and that's, I can tell. Is there any other debate on the amendment? If not, the vote recurs on Senator McMahon's amendment. All in favor say aye. All opposed, no. It appears the noes have it. The noes have it, and we're back on the bill. The bill is before us. Is there debate on the bill itself? If not, are you ready to vote on the bill? The motion's title sufficient, do pass. All in favor say aye. All opposed, no. It appears the ayes have it. The ayes have it. We'll report that to the floor. I'm told that regarding House Bill 1034, which has been held on a motion to reconsider, that there has been some amendment to the Medical Cannabis Act, Compassionate Access. Is there someone who has such an amendment to offer? I don't see anyone. Okay. Regarding House Bill 479, the Universal Recognition of Occupational License Act, I'm told that there is an amendment that someone wishes to offer to that bill. Is that correct? Senator
Ye-
Blackwell?
Yes,
So,
sir. it is.
okay, Senator Blackwell, then would you like to move that we take House Bill 479 from the table?
Yes, sir.
The motion is to take House Bill 479 from the table. All in favor say aye.
Aye.
Opposed, no. The ayes appear to have it. The bill is now before us. The pending motion is title sufficient to pass. Senator Blackwell.
Just to refresh the committee's memory on this, this was a House bill that amended current universal licensing statute to give the psychology board and the board that license marriage and family therapists an additional 30 days from the current 30 days to 60 days in this bill for temporary licensing. The extension was requested because they've had issues getting the required criminal background checks back in the current 30-day period. Senator Hill raised a good point. There was some confusing language in the bill that would lead to appear that even if there was adverse background information, that these individuals could be licensed up to a year. So our amendment fixes that. It reads, amending on lines 139 through 142 by deleting a temporary license will expire in 365 days after its issuance if the applicant fails to satisfy the requirement for licensure in subsections 3 through 5 as applicable, and insert in lieu thereof the following. If either the required criminal background check or the required education, training, and examination inquiries are returned to the licensing board as insufficient for licensure as specified in sections 73-3114 and 73-3115 for the practice of psychology, or in section 73-5423 for the practice of marriage and family therapy, the licensing board of the psychologist or of the marriage and family therapist, as the case may be, shall suspend and revocate the temporary license of the applicant upon notice of the insufficiencies and notify the applicant of the revocation. Nothing in this section, it'll be further amended below line 175. Nothing in this section shall replace or remove an applicant's requirement for compliance with education, supervised training, and examination under section 73-3114 and 73-3115 for the practice of psychology, or under section 73-5423 for the practice of marriage and family therapy. That's an explanation of the amendment. I'll yield for questions.
Questions, Senator Blackwell moves adoption of the amendment. Are there questions on the amendment? Not, the vote occurs on Senator Blackwell's amendment. All in favor say aye.
Aye.
All opposed, no. The ayes appear to have it. The ayes have it, and the amendment has been agreed to. Now Senator Blackwell moves title sufficient do pass as amended. All in favor say aye.
Aye.
All opposed, no. The ayes appear to have it. The ayes have it. We'll now go to House Bill 1067, the Rural Health Transformation Program. Senator Hickman moves
Yes,
title sufficient do pass,
absolutely.
and Senator Hickman's recognized to speak on the bill.
Thank you, Mr. Chairman. This bill comes to us from our friends over in the House. As all of us know, we applied and received funds from the Rural Transformation Fund. These funds come out of what I've heard being coined now is OB3, the One Big Beautiful Bill. And this bill takes in consideration that Mississippi will receive tranches of money, and each one of those deposits of money has to be spent within 2 years. What this bill is doing is trying to set up a process of transparency and fairness at how those funds are dispersed. It simply requires procurement of goods and services, requiring that they go through our procurement process. It also requires that priority be given to what was placed in the application as far as what these funds would be used for. The one thing I will say about this piece of legislation is not taking away control from, or it's not the legislator trying to take control of these funds. We're just trying to make sure they're administered in a fair and transparent process. The pertinent language in this bill is going to be lines 20 through 112. So it's really a short bill. There's a lot of other language because it just pulls our procurement statute forward in lines 112 and beyond. So basically, it requires that all vendors, subcontractors, and other entities that are selected to provide goods, products, and services through the State Rural Transformation Fund go through the regular procurement process. And if they're given in the form of a grant program, that these grant programs prioritize rural communities at the fund for funds of distribution. If you look at lines 38 through 50, this provides examples of goods, products, and service that procurement may apply to, including comprehensive statewide assessment of rural health needs, purchase of equipment or technology, educational workforce programming. And these are examples that came directly from the application that we submitted from the state. Other pertinent parts is line 72 through 93. It's provided that grant programs administered using these funds will prioritize communities that are super rural zip codes, counties designated as health professional shortage areas, counties with high infant mortality rates, counties with per capita income of less than 45,000, counties with hospitals receiving disproportionate share of funds, counties lacking hospital presence or containing a rural emergency hospital, critical access hospitals in areas outside of metropolitan statistic areas. And these are, again, examples that came directly from the Transformation Fund application. The final thing I'll bring your attention to is line 94 through 100. It simply asks that we prioritize subgrantees that have not received a direct state or federal appropriation for medical equipment or capital expenditure in the last 5 years. So again, this bill basically, is not the legislature trying to take over the funds or disperse them. It's simply a transparency measure. And it also, I'm sorry, I said that was the last thing, but the other thing, it also requires that there just be a report of how these funds are spent to given to the legislature. That's a brief explanation of the bill, and I will yield for any questions.
There are questions on the bill. Senator Fillingane.
Thank you, Mr. Chairman. The question would be, these funds that are already coming from the federal government, do they already have requirements and protocols and procedures that the states must follow in order to qualify under the federal legislation?
Yes, the federal legislation did come with that. And I mean, I would just remind us that we've received several deposits of money from the federal government that also came with regulation that came from the federal government, but the state chose to take action to place some legislation on that. And again, we're not saying here, we're asking for our priorities, but in no way are we telling how it can be spent, what needs to happen. We're just looking for some transparency measures and to make sure that this money goes to the communities that need it the most.
And so what this legislation would seek to do would be to place additional rules and requirements on top of the ones that already came with the monies from the federal government?
Absolutely. It would be this body doing what we do, making sure that Mississippians are taken care of and this money goes to the most needed. So we'll put some regulation out there to just make sure that happens.
But in doing so, would you not be requiring those who are parceling the dollars out to take additional time to make sure all of the federal rules are met in addition to all the state rules that we'd be layering on top of the federal rules?
I don't think that this is going to be a measure that's going to, require an extensive amount of time or administrative burden. And again, we're just looking for transparency and just requiring the money to go through this, a procurement process. Now, we could have, this legislation could have pulled the funds, said exactly how they had to be spent, what had to happen here, like we've done in ARPA, like we've done in CARES and other situations. But here, we recognize that there's a 2-year burden that the state has to spend this money. So we're not saying that it needs to go through all these hoops. We're just simply asking that these funds be administered through the procurement program, and then they give priority to the things that were actually stated in the application.
And the time frame from which we must spend the dollars from the time they're received is what? Senator
2
Hickman?
years for each, we'll get several deposits. Each, those deposits have to be spent in 2 years.
Okay. And just to be clear, if this becomes law, then those who would seek to access the funds and those responsible in the state government for parceling out the funds would have to comply with both the federal set of rules and the newly imposed state set of rules.
Yes, and these are not, and again, these rules don't conflict with the state rules. And as a legislature, we've done this in many times with money that's come down from the federal government. Again, we're just trying to make sure that there's transparency and that these funds go to the communities that need them to the most.
Thank you.
Other questions on the bill? Senator Wiggins.
Senator Hickman, along the lines of Senator Fillingane's, it's, although I don't necessarily come from what's known as a rural area, we know that the rural hospitals are in dire need of assistance. And this bill correctly goes into effect July 1st.
Yes.
Okay, so then there's going to be a whole other process by which this needs to take place before these hospitals can get this money, right?
Well, I think so, and I'll be honest. Of course, it's a House bill. I've read it and I've studied it, and it's my understanding that some of the funds have already been procured, and we've already like they started the spending. So this would go in effect on July 1st, and then this process would start. But it's my understanding that the first tranche of money has already come, and we've already secured vendors to do certain things from that set of money. So I think you're saying like this is going to hold them up, and then in July they have to start new procedures and stuff like that.
Yes.
I don't know if that's particularly the case, because I mean, this is a process that we have set up. I mean, it's the state's procurement process. So I don't think it's anything foreign or somebody's going to have to learn or go through. Like, I mean, it's the process that we already use.
Well, no offense. If your defense is the state procurement process, that's a whole other discussion we need to have, because
Well,
I know, and that actually is going to my point, which is that our procurement process is in serious need of review, and this is going to put that into that, correct?
this will, but I think it's the best framework that we have for right now. And again, it keeps a learning curve. It's not like we're creating something out of thin air. We're given a process that's already being used, flawed or perfect. We're given a process that's already being used. And so it doesn't require our agencies or whoever's administering this or whatever administration to come up with some new process. It's already a process that's in law. And again, I don't disagree with you at all about anything that you're saying. In reading this bill again, this is not my piece of legislation, but I support it because I think it creates a framework by which we have, one, transparency, we two, have a process, and and three, we're making sure this money goes to the people that it need to go to. I mean, we have seen, I mean, they're over in the courthouse somewhere right now. There's a trial going on for what happens when we don't have frameworks in place and we get big federal dollars and people use them how they want to.
Well, I understand that, and you yourself said the feds put that in. So my last question is, if this doesn't pass right now, or not even that, but right now, as it's operating, these hospitals, I know you already said have gotten some money. The program would start in like a month.
Well, I think,
Correct.
yeah. Now, I don't think they've gotten any money. I think we have, from my understanding, some vendors have been procured or hired already. I don't think any money has gone out yet. And I could be wrong. There may be somebody better equipped to answer that portion.
Well, having done Medicaid, I can tell you when vendors and RFPs and all don't go the way they go, we spend a lot of time in court because they go and sue. And then just ask Chairman Hobson about the Medicaid, because we continue to have delays and delay because these vendors or whoever it is go and sue the state because they didn't get what they wanted. So I get concerned about that.
And I absolutely understand and appreciate your concern. I think the matter of fact is that we received a blessing that our rural hospitals need, and we like this piece of legislation is just trying to make sure that those funds go to the right place. And I get it. Of course, I'm a lawyer. I love a good lawsuit, just like the next person. But hopefully, this is actually a piece of legislation that's going to help us do what we need to do and not hurt the system, because it's not my desire. And we talk about it all the time. Of course, I mean, everything that we do in this building, there are intended and unintended consequences. But my hope and what I believe in reading this is that it has more good consequences and intended consequences than unintended consequences.
Senator Hobson.
Thank you, Mr. Chairman. First, for a point of clarification, I think this bill is effective upon passage, correct?
I would venture to say yes, if the astute chairman says so.
Unless I'm looking at the wrong one. I think the original bill, I don't think we have a strike all on this, but it is effective upon passage. And
Yes, it's effective upon passage.
I think, unless you can tell me otherwise, Senator Hickman, that part of the reason it would be effective upon passage, to Senator Wiggins' point, is to start getting the funds out rather quickly once everything's in place. Was that your understanding?
That's my understanding, and I'll add to that. This piece of legislation from our friends in the House that brought it to us, and anybody I've talked to about it, there was never this idea to slow down the process. We want the process to move forward as quickly as possible. We just wanted to put some guardrails to make sure that the state's protected and the state's most needy places and the hospitals are protected.
Do you know who our authorized organizational representative is for the rural health care program funds?
I do not.
I'm concerned. I don't know exactly either. And I was hoping you might know, or someone, the chair, someone might know. I am concerned about this because I can't find it in the things that I reviewed. I can't find clarity in how these funds are to be administered. And if I'm going to ask a question, that you mentioned the CARES Act and ARPA and things like that. Those were funds that were given to the federal government, given to the state, I mean, from the federal government for us to utilize. This was actually an application, correct?
Yes.
And I've tried the best I can to look and see in the application process and in the award of the funds how those funds are supposed to be administered. And I can't find clarity that it's the legislature. Have you found any clarity that it is the legislature, or that it is the Department of Health or the governor's office or Department of Mental Health or anyone else? Do we know?
Well, in the One Big Beautiful bill, I don't think it's clear at who administers these funds, but I do know there is nothing in there. And I think the way this works is that the legislature alone has a power to appropriate funds unless federal legislation says otherwise. And nowhere in there does it take that authority away from us, as far as I know and see it.
The only concern I've got is this is an application process as opposed to an award, which again, I just want to get the right answer here, and I don't know what the right answer is. So I think while we all continue to look at it, Mr. Chair, at the appropriate time, I want to offer an amendment.
And let me say this, I think this piece of legislation was written just like ARPA and the COVID funds. The federal piece of legislation was written just like ARPA and the COVID funds. And if I can peradventure know what your amendment is, I don't think I have any disagreement with that at all.
I think for the time being, I'd like to put a reverse repealer in it because I do not feel comfortable. I certainly, in my rationale, Senator Hickman, is I don't want to do something where we potentially lose funds because this is not done the right way. And I would like more clarity as to how this is supposed to be done. And I'm also concerned too about the procurement issues that Senator Wiggins and I think Senator Fillingane also raised.
And I feel very comfortable with that. Like I said, I think I was psychic and I knew what you was going to offer. I have no issue with that. As we've talked before, anything that I do in this building, I want to do something that's going to be good for the state of Mississippi. And that makes me feel comfortable us putting a reverse repealer in and finding the answers for the questions that you have.
Thank you.
Senator Hobson has moved that we amend the bill by having a reverse repealer. Is there discussion or debate on that amendment? Ready to vote on the amendment? All in favor say aye.
Aye.
All opposed, no. The ayes appear to have it. The ayes have it, and that amendment is agreed to. We're now back on the original motion, title sufficient to pass as amended. Is there further debate or discussion? Senator Hill.
Just want to make a couple of comments. I was not in the legislature when Katrina hit, but I did follow a lot of how some of that money was spent. And unfortunately, a lot of that money was misspent because it was trying to be spent in too big of a hurry. One thing that comes to my mind is all the infrastructure that was built out for the Gulf Coast utility authorities that nobody's still using to this day. There's treatment plants out there that might have 1 or 2 people on it. There's fire hydrants and piping that goes out through the middle of nowhere that nobody's on. So my concern with this money coming from the federal government is I don't want to see the same thing happen that happened to a lot of that Katrina money. It's basically just people were paid to do a job, but nobody benefited except the people that got the payment. So I don't want to hamstring this, but I also want to make sure that this money is spent correctly. And I think we do need some time to adjust to dig into it and learn more about it, because the legislature really doesn't know a whole lot about this. And that's another thing that kind of bothers me, that we don't know a whole lot about it. So I support that amendment that Senator Hobson had, because I think we do need some time to look at this and digest it as a legislature.
Someone is moving the microphone around as though he or she is seeking recognition. Is Senator Boyd, is that you?
Yes, thank you.
Senator Boyd.
I'm going to concur with Senator Hobson and Senator Hill, but there's one thing that really bothers me in looking at 75 through 93. We talk here a lot about counties. We talk,
Senator Boyd,
we
could you
speak in-
please speak directly
okay.
into the microphone? You know, we had this wonderful sound system until we had all these improvements. And now you have to speak right into the microphone.
Thank you. It's a fabulous system. I think the thing that concerns me is looking at how this is articulated out. Basically only from 80 to 82, do we really talk about the individuals that this is seeking to serve? So we're not, one of the things about the Rural Transformation Grant was really talking about populations, really looking at mental health issues in our rural areas, looking at services for special needs. There were different things like that that were really articulated out in that grant. I don't see these really specified through here. So now that this has a reverse repealer, I would really suggest that we really look at the people that it's intended to serve.
And Senator, I do not disagree with you, but the one thing I will say is that this language, a lot of it was derived directly from the application that we submitted. And again, it has a reverse repealer in it. Of course, this is a House bill, but as much as the chairman will let me work with you and whoever else, I'm willing to do that to make this a good piece of legislation.
Thank you.
Further debate? If not, the motion recurs on the vote. Title sufficient do pass as amended. All in favor say aye. All opposed, no. It appears the ayes have it. The ayes have it. We'll report that bill to the floor. Next, we'll go to item to House Bill 895, medical cannabis. Senator Blackwell moves is title sufficient to pass, and Senator Blackwell is recognized to speak on that motion.
Thank you, Mr. Chairman. HB 895 extends the medical cannabis patient cards up to 24 months. It removes the statutory THC caps on cannabis tinctures, ointments, oils. It eliminates a mandatory 6-month follow-up visit while preserving full physician discretion. It extends cannabis caregiver cards to 5 years, and it does not expand access. It does not loosen purchase limits, and it does not weaken oversight. That's an explanation of the bill, and I've got an amendment at the proper time, which
It's always a proper time for an amendment.
thank you, Mr.
recognized.
Chairman. After this bill came out of the House, I had a number of calls from practitioners who had some concerns with it. Since that time, I've met with a number of physicians and other practitioners. And my amendment basically reverts back to our original language. So patient cards will only be good for a year. The patient will have to have a 6-month follow-up. I did amend the cannabis caregiver cards from 5 years down to 2 years. And that's an explanation of the amendment.
Is there a debate on the amendment? If not, the vote recurs on Senator Blackwell's amendment. In favor of that, say aye.
Aye.
Opposed, no. The ayes appear to have it. The ayes have it, and the amendment is adopted. Now, Senator Blackwell, we're back on the bill itself.
I'll yield for any questions, not move for passage.
Are there questions on the bill itself, Senator Hill?
So I'm looking at the last line of the short title, so there'll be no potency limit for THC tinctures.
That's correct. Ointments or oils.
Okay, so
And we're the only state that has that currently. And we did that originally just for safeguards, but
well, it looks to me like this is going along the same lines of any other drug that you take. You need more and more and more of it. Is that why we're
well,
continuing to raise?
you may recall earlier in the session, we actually defeated a bill, a pharmacy bill, in which the pharmaceutical companies wanted to add in fillers into their medications. That's what we're currently requiring. And so what this does is we're going to be removing those fillers. And actually for the folks that produce it, it's a lot more costly for them. It's unregulated. You don't know what you're getting in it.
Further debate or discussion? Senator Blackwell moves title sufficient do pass as amended. All in favor say aye.
Aye.
All opposed, no. The chair's in doubt. Let's try again. All in favor say aye. All opposed, no. Believe the ayes have it. It appears the ayes have it. The ayes have it. We'll report that bill to the floor. I'm told that Senator England now has a motion on House Bill 1034. Is that correct, Senator England? Okay, gave you a,
That is correct, Mr. Chairman.
I gave you a promotion there.
That's right. So my motion, procedurally, I was waiting for the motion to move it off the table, but I didn't understand the chairman was doing that. And I thank you for the opportunity.
So now the motion that Senator England wishes to make is that we do reconsider the vote by which House Bill 1034 failed.
That is
All
the
in
motion.
favor of that motion that we do reconsider, say aye.
Aye.
All opposed, no. It appears the ayes have it. Division has been requested. All in favor of the motion that we do reconsider the vote on House Bill 1034, please raise your hand. All opposed? By a vote of 6 yes, 7 no, the amendment fails. Let's see, where are we now? It's 3:50 and we convene at 4 o'clock. I think the best procedure probably would be to entertain a motion to rise and report progress. I'll run upstairs and call a committee meeting and we'll find out what else is meeting. My intention is to call immediately upon recess and consider House Bill 1665. I just think it'd be better if we did that all at once instead of in the middle. So the motion is the rise and report. All in favor say aye. Opposed, no. The ayes appear to have it. The ayes have it. Thank you. I will call the committee to order and ask the secretary to call the roll.
Brian,
Here.
Parks, Barnett, Blackwell, Blunt, Boyd, DeBar, England, Fillingane, Frazier, Harkins, Hickman, Hill, Hobson, McMahon, Tate, Turner Ford, Wiggins. We have a quorum.
I do want to point out that I learned something in the last committee meeting. There was a reference to TEDx. I'm not sure I know what TEDx is, but I am certain I won't be able to tell the difference between TEDx and GEMX. Get them confused. It's late in the day. We have one bill to consider, the pharmacy benefit bill. I would say regarding bills that were not considered, there are a number of bills that I thought had merit. Some of them I thought needed some more discussion with some of the players. Some of them I've discussed with the author and about potential for next year, and some I think we can accomplish without legislation. But there's only so many hours in the day, but we convene every year. Having said that, we'll go to House Bill 1665, the Pharmacy Benefit Prompt Pay Act. Does anyone wish to move title sufficient do pass on that bill? Senator Parks moves title sufficient do pass. The bill is before the committee. Senator Parks, do you want to explain the bill? Do you want to offer an amendment? How do you want to proceed? Senator Parks wishes to offer a strike all amendment. You're recognized to do that. I assume somebody somewhere has copies of that. All right. Senator Parks, you're recognized to discuss your amendment.
Thank you, Mr. Chairman. The bill that's before you, number one, I want to thank the House committee. They had several meetings with different organizations throughout the summer, including the different independent pharmacists. I think some of those attended as well. I appreciate, again, there was so much work, so many code sections that were opened up, giving us an opportunity to hopefully we'll be able to work through some of this today. I'll be able to answer some of your questions. We'll be able to pass this out of committee and keep it moving forward so that we could potentially get something for the independent pharmacies. With that being said, the strike all that's before you, if I may take the liberty to just kind of walk through, I won't walk through every section because a lot of these sections are the exact same language that you have been looking at for the last 3 years. And I'm happy to answer questions on any of those sections. The other part that I think I would like to move forward with is that with the help with the House and all that their works that they did, I then asked the independent pharmacies, what is the most important thing to you that we could do to help you? And out of that, I was given three topics that's inside, and it's, number one was steering. Number two, and that's prohibiting the steering of patients to PBM affiliate pharmacies. Two was in this bill, the House had gone through and wanted to move all the regulatory authority to the Department of Insurance. And what the will of that would be wanted is that the regulatory authority would go back to the Department of Pharmacy. And then the third would be reimbursement. And with that being said, they're asking that we use the methodology that would be used by Medicaid or no less than the affiliate pay. And with that, I went back and said, okay, out of the three, what do you really need? And we left with that, we would remove steering. So I hope everyone understands that all steering has been removed, all language has been changed from the Department of Insurance, them wanting to move it to the Department of Insurance back to the Department of Pharmacy where it is currently today. And we would, and with that being said, I reached out to the insurance commissioner and asked him his thoughts on this. And we had a long conversation where that, to sum it up, he believes that it belongs with the Department of Pharmacy and not in his department. So he is very pleased with that decision, and that's where the independent pharmacists would like for this to go. If I'm happy to go over any section that you all might want me to. I think I will ask if there are sections you want me to, because you've seen this language, like I said, for the past 3 years, and it hasn't changed, other than what I just called out for you.
There are questions on the amendment. Senator England.
Thank you, Mr. Chairman. And Senator Parks, thank you for your work on this. I know you've worked on it a great deal. What does your strike all bill do differently than House Bill 1665?
Just what I talked through.
Okay.
It puts back the authority of the Board of Pharmacy, because they had gone through and wanted everything to go into the commissioner.
Commissioner Insurance, correct.
Okay, so that is the main focus of what the changes you're looking at that they had changed.
Okay.
And they also talk about, I want to be fair too, I missed this. In section 5, we're not, it's totally new language, the PSAO requiring being licensed like a PBM. A PSAO is, they represent the pharmacy, and they're the go-between the PBM and the pharmacy. And they're really just a trigger, a paper trigger that, when they get paid, they get paid.
Okay. And that's the only, I know you mentioned 3 things, but I think House Bill 1665 actually does prohibit steering and provides for reimbursement, correct?
The 1665, it provided for steering, and we removed that.
Okay, that was not my reading of it. One thing that I saw was that they didn't have steering, but that's
Yeah, it doesn't, there is no steering in this.
in your strike all. Yes, I understood. And the reason I'm asking about HB 1665 is I was contacted by several pharmacists this past weekend and was asked, please take House Bill 1665 with no amendments. And honestly, that made my heart leap, because we have been working on this. And I know through talking with individuals about HB 1665, there's things that the independent pharmacists aren't 100% happy about it. There's things that the business community and others aren't 100% happy about it. And I said, okay, well, great, we've reached an agreement. And I told the independent pharmacists reached out to me, okay, if this is it, I'll vote HB 1665 as the House Senate over. I'll listen to any amendments, but they expressed to me they were happy with this bill.
I think there was an unfortunate communication that went out.
What was that? What was the unfortunate communication?
When they were talking with their lobbyists, they did not convey that there would, I don't think they understood that there was a strike all being offered. And they understood what they covered with them and what the changes were going to be, and they were happy with that, which was what the strike all represented. So, but if you're wanting to go with your, 1665 and you're wanting to vote against this, I totally understand.
Yes, thank you. And before I do that, I would like to, and I won't do this through the form of questions. I'll just speak on House Bill 1665 and on your motion a little bit later. But you mentioned that, this is a bill that's before us. It's been before us for 3 years. We can go through it, section by section, and I don't think anybody in here wants to do that because it is before us again. But if you'll recall, last year, I asked what effect this bill, your bill, the strike all, has on the state health plan. And I'll ask the same question here. What your strike all, what is going to come of the state healthcare plan?
The state healthcare plan, if you look at the last 3 sections, it's in here, and it very much defines it as how it would be considered.
Okay, and how is that? If you don't mind, I haven't had a chance to look at this, so if you can tell me what we're doing with the state health plan in your strike all.
I mean, it simply falls underneath the formula.
Okay, so with the state health care plan included, have you asked for a fiscal note on this bill?
No.
Okay, and that was a big point of contention I had last year because obviously the state plan uses benefits and provides for health insurance that includes pharmacy benefits, correct? So we don't know what the cost of doing away with that is going to be to the state of Mississippi.
We do not, but if you go back and you look at NADAC and all the different formulas that is used in that health plan, NADAC is the more transparent one and is generally 22% less cost than the others. So with that being said, I think that gives you an idea.
Well, it does, but I mean, a fiscal note would obviously give me a better idea, I would think, because the issue that I'm hearing from obviously my independent pharmacist asked me to vote for this bill, and I'm kind of hung on that. That's because I didn't get asked to not. And the other issue is if this is going to cost more, and it's going to cost the state health plan more, it's going to cost teachers more to get their prescriptions filled at the end of the day.
Let's just back up and let's talk
Okay.
about, you want to talk about the state health plan? Well, let's move to, maybe I can give you a comparison.
Okay.
In 2017, whenever the state of Mississippi went to the flat fee NADAC 1129, there was $88 million saved the very first year. Now, 33 million of that went to pay the flat fee of the 1129. So it was still a net savings of $55 million. So I would think if we saved money in the Medicare plan, then why would we not save money in our state plan?
Are we saving money in the Medicare
Yeah.
plan? 'Cause I know we had at least a Medicaid issue. We had to come back and pay a deficit. I'm sorry, I think Senator Hills answered the question for you, and I'm happy to let her do so if she would like to, but I'd also like to continue our conversation. Oh, I understand. I think we're all tired. Well, look, I'll come back to that because I've also heard from our business community that this is going to cost a lot of money. And I think it makes sense. I trust these individuals. And so I'm worried that if we don't either pass HB 1665 as is or continue to work on this, to work on things like the dispensing fee that we're requiring in this bill and using NADAC. And I understand that there's several different ways to look at pricing. There's several different methods. Is that correct? So NADAC's not the only one that you can use, but we would be requiring it here, I'm guessing, right?
Yes, it would be the preferred because it is a transparent, it is one that is reviewed and kept in sync every week as opposed to the other.
Right, but they don't look at all pharmacies.
Yes, they look at all pharmacies
Okay,
on NADAC.
I'll have to double
This
check that.
calculation. Okay.
Right, and I'm happy to, and I know we're in committee, we can move
Yeah, we
through
can
that.
both look that up and
The,
clarify.
right. If your strike all passes, are we getting rid of affiliate pharmacies in Mississippi?
No.
Okay, when I looked at your bill, and I know we've got a different strike all in front of us, there was a different section. It was section 14.2A. I don't know where it is in your strike all, but I know in your, in the bill that you presented, and I imagine we're pretty close to the bill that you dropped. Is that correct?
Similar, yes.
Okay, it not only said that, you know, these commercial pharmacies that either use or are affiliated with a PBM, that they can't operate a pharmacy, but they lose their license and they're effectively outlawed.
No, we're not trying to do away with any CVSs, or we're not trying to do away with, Caremark. I mean, no.
Yes, no, I understand. And this, in your original bill, and again, it was section 14.2A. I'm happy if we take the time to find it in this bill. It said a pharmacy benefit manager shall not acquire direct or indirect interest in or otherwise hold directly or indirectly a pharmacy permit for the retail sale of drugs or medicines in this state. And then subsection B says, on and after the effective date of this act, the Mississippi Board of Pharmacy shall either revoke or not renew a pharmacy permit of an entity that violates this section.
And I think that's going back to the steering, is it not?
No,
Oh.
that's not going back to the steering. That's
That's
under a section, that's where we're amending code
Yeah.
7321-215. And I don't know how we can get around that saying that these commercial pharmacies can't operate. And not only can they not operate, they're going to have their license or their permit revoked or not renewed.
I'm happy to look at that more closely.
Yes, I would appreciate to have a chance to look at that more closely.
Yeah,
Senator
get
Parks,
back with
thank you.
And whenever we get to the floor, I'm happy to answer that question.
Okay. There was the dispensing fees. What are we doing with dispensing fees there? Because that's another issue that I understand. There are big employers in the state of Mississippi and small employers, quite frankly, that are providing insurance for many employees in the state through contracts that they have negotiated for these fees with. That dispensing fee basically nullifies those contracts. Is that correct?
It could potentially on some, and let me clarify what I think maybe too that wouldn't null and void, but one of the things that it talks about in here is the cost of, if a prescription is only $10 and the copay is $25, then the patient would only pay $10. That may be something you're referring to.
Mhm.
Now that doesn't mean that you're null and voiding every contract out there. I mean, you have different types of drugs and different, sections of drugs. So I don't, to that point, I don't think it null and voids every contract to its letter.
Right. Well, the dispensing fee is pretty clearly outlined in the bill, right? It basically requires the dispensing fee to be what we say it needs to be.
Right.
Okay. Now, that dispensing fee, that's regulated by the pharmacy board?
It is, what happened now, it's actually regulated right now. How it came into being was through the Medicare. When the federal government asked in 2017, 2016, that there be a set fee along with a formula for the drug, and that was when NADAC was.
Right. And we all know, I think, or at least a lot of us know this, that Medicaid and Medicare have worked to effectively increase the costs of healthcare in this state. But that I guess I digress a little bit there. But my concern is still there, that doing this is going to increase the cost of prescriptions. The end user, if we take away this ability to contract these rates from employers to work with their employees and to work with these insurance plans to provide pharmaceuticals for their employees at the lowest cost, and we come in and say, you can't do that, you have to use these regulations, we're going to take this approach, the person that's going to end up paying that cost is our teachers and our shipbuilders and our truck drivers. Those are the ones that I'm worried about. And I say that because I want you to understand, I'm not against the independent pharmacists. I'm for PBR reform. I dropped a bill myself. But when I got asked to look at this bill, at House Bill 1665 and pass it with no amendments, I did just that. And I think we've got a good bill in front of us in the form of House Bill 1665. So-
One thing I would respond to you on, if you understand how that our costs are currently being negotiated, that's through a PBM, which is actually negotiating the cost from the manufacturer and then going back and negotiating that between the insurance company. In the process of doing that, it's an opportunity for inflation at every step of that. Where if you go with NADAC, that is a known national cost with no inflation. And so I guess I'm asking, I guess I'm not understanding how that you derive that would cause the price to increase on the drugs.
Well, because we're requiring a fee that is added on top of the
If I'm speaking
prescription.
just like we did originally when we passed this for the Medicaid, we saved money. You know, everybody thought we couldn't save money there either, but from the calculation of NADAC on the drug cost itself being so much cheaper, you were still able, even though there was a fee, you were still able to, make $55 million in profit. So I think that since that is an example and that's already out there for us, it would be difficult for me to, and this is something that we talk about each time that, our employers, that the alarm is sounded that the price of insurance is going to go up. And I have two comments on that. Number one, they've never broke it down to me why and how that the price is going to increase.
Mm.
And then number two, addressing the increase of insurance costs. I don't know about you, Senator, but I know that my insurance has gone up year over year, anywhere from 14 to 17%. And I don't ever understand why it went up, but at least this time I might have an idea what caused it to go up, if it really does go up.
Yeah, and I'm failing to make the connection on how we're going to require these dispensing fees to be at a rate that we're going to set in statute, and that's going to lower costs somehow on our folks. And look, when we get to the floor, if your strike all does pass, I think maybe the fiscal note could help us do that. And I'll get with the attorney and maybe with the chairman to make sure that we do properly get a fiscal note, because I didn't get one last year, and I would certainly like to have one this year to know what that cost would be. But on the dispensing rate, I would note that you keep mentioning it. We mentioned the Division of Medicaid and its reimbursement, but we actually are using the greater of the total reimbursement paid to its pharmacy benefit manager affiliate, or the total reimbursement paid by the Mississippi Division of Medicaid in its pharmacy reimbursement methodology. So we're using the greater of the two. So we're not really just sticking to the Medicaid.
Yeah, it's not less
Cost.
greater the two if it was an affiliate. You have two steps there.
Right. So and whichever one's the greater is the one that we're going to require to be paid.
Right.
Yeah, that's a tough sell for me to understand how that's going to save costs.
Well, it's because you're doing it on the NADAC as opposed to a negotiated cost that allows a middleman and two other layers to profit from that cost.
So what does HB 1665 do with as far as reimbursement and these pass-through costs and discounts? Because it's my understanding HB 1665 allows those to pass down, which is just what the independent pharmacists have asked for.
Now, it did not allow it in that term because you don't know what that's going to be based on the negotiation. And that's always subject to change because they do not have to share currently today what those negotiated prices were, nor do you have to share with what the rebate is. It's going back to that provider and then on to the employer.
Are we limiting them on how they can negotiate? We're saying you can only use NADAC. That's a limitation on their negotiations. Is that what I understand?
Well, it would be the NADAC cost plus the 1159 and a lot. And
What's the what? I'm sorry.
The 1129,
What is that?
the flat fee. But
Oh, there's a flat fee. Okay.
one of the things that I would say too is we often want to know what the states around us are doing. And, you know, I applaud Tennessee, every state, Alabama, Arkansas, Louisiana, Kentucky, all of those states around us have adopted this formulation.
Mhm.
And they're all, you know, and at this point, there have been no issues or concerns. And I totally understand if the PBM lost those states, and there's several others as well. We are at a turning point. Do we continue to put our people and paying higher rates and not being allowed to go where they want to go? And putting all these stipulations, even at the expense today that our insurance cost us, that we still have these issues. And so I think with a lot of that being said, you know, we're not walking out on a limb that's not been tested. We're not walking out on a limb where you hear all these states screaming that my prices have gotten higher and the employer going, oh, my prices are higher.
That's right.
I think this is an opportunity to get into its chartered waters now, and an opportunity for us to be able to help our independent pharmacies. And that's a decision that each of you individually today have got to make. You know, an independent pharmacy, and I know what it means to me, and especially in rural Mississippi, is that there's somebody watching the care. That if I've got multiple drugs that I'm carrying, and this goes for, and I'm sure you've heard your grandparents, your aunts and your uncles, you know, they're watching that, they're helping them to make some of those just tough decisions that they would know otherwise. And if something was coming through the mail, they would just take it.
Right.
And no one's really watching out for them in those types of situations. And, you know, this is all about, you know, we want to talk about the independent pharmacies, but this is about our constituents and the health
Oh, I agree.
and
Absolutely.
totally moving forward. So
PBR reform is absolutely needed. In our, like you say, other states have done this, and I'm sorry but the reason I wanted to jump in is because you mentioned that the steering, you know, steering is an issue where you steer you steer somebody away from one pharmacy to another. And again, I looked at HB 1665 and steering is not in there. That's one of the things that, you know, that we've looked at. The people have listened to independent pharmacists. Okay, yeah, we agree. We're going to do PBM reform. We're going to knock that out. You know, by the way, there's no more underpayment through spread pricing or below cost reimbursement or retroactive clawbacks under House Bill 1665. Again, that's another thing that the independent pharmacists have asked for, and we've heard them, and I think that's great. Claims must be paid in 7 days. I'm sorry, if they're made online, and must be and interest is to be paid if it's not late. That's another thing independent pharmacists have asked for, and it's right there in HB 1665. HB 1665 creates a defined appeals process, just as your bill does, I believe, and it correlates rates for. It requires rates to apply for 90 days after that point. Again, no steering. There's transparency. You have to have a clearly defined dispensing fee and an ingredient fee. It prohibits deceptive spread pricing, which is an issue. So when we mention that we're working on PBM reform, HB 1665 is that. And the reason I know that is I looked at it when I was asked to vote for it, and I've talked to the ones that had concerns that are, and these are business people that are looking at their bottom line, and they're saying, well, if we don't have the ability to contract on our health insurance plans, our self-insured plans, or our ERISA plans, which is another completely different issue, because I think that's preempted by federal law, and I know you and I had that debate last year. And since then, the Supreme Court has agreed that ERISA is preempted by, these ERISA plans are preempted by federal law. And look, let me stop there and ask, are ERISA plans carved out in your strike all?
yes, they are not in here.
Can you show me where that is? Because I didn't find it in your
Yeah,
original
they're
bill.
they're not in my, they are not.
Oh, I know, we're on the strike all, but that's what I wanted to see where that was carved out. Because this is the strike all we were handed out earlier.
Yes.
Okay, yeah, if you'll show me where that's, or if you'll tell me where that is, because I'm really concerned with that, because that's going to cost
That was
our
all
businesses
sections
lawsuits. Section 7?
Section 7 and is not even, it's not in the document. If they had to renumber it, if you look at the original and you look at ours, you'll see that entire section has been struck. Therefore, we're giving it a renumbering structure.
I'm sorry, I couldn't hear you, Senator Parks.
Now I said it, so therefore it gave it a totally renumbering structure.
I'm scanning here. I don't see it specifically excluding ERISA plans, and that would be a big point for me.
There is no,
And
it's not in there, so it has to omit it if it's not even spoken.
well, but it is a health plan, and health plan is defined in your bill, and it's not exempted there either.
But it doesn't mention it either.
Well, I know that's great, but when we're
And
writing our
in
laws, I can tell
definition-
you it's
but in
it's
the
much better to.
definition, it is not, it's not referred to it.
That's right. Well, I can tell you, I
It's not
certainly prefer
considered.
us to write in exemptions where we intend them rather than just say we didn't mention them, so we're gonna let that happen. So that's something that really bothers me. And the same with our self-insured plans. We have a lot of people in the state of Mississippi that have worked really hard on these self-insured plans, and I'm glad they're able to do that. Because we want our employers insuring individuals, like we want, like Homac and Ergon and people, these are people I've heard from that are very concerned that if we adopt a bill similar to what was presented last year, which is what we've already established, we've seen this before, we've seen it for 3 years. They're very concerned that this is going to cost an increase for their employers. MTC in the Meridian area, they're one that is worried about increased costs if we pass this bill. And I guess my concern there is that we can.
Stop you right there. When they contacted you and told you that they were going to have an increased cost, did they break that down for you? And could you share that today with us?
Well, I didn't, look, I'm sure they could break it down for me. I'm not sure I would explain exactly what they do, but these are business people, you know,
I
they're
totally get it,
building
but I-
nuclear ships.
Repetitively, I hear
Right.
it repetitively, and I just so would
Right.
like to see that.
Yeah,
And,
well, listen, I think that's a great point, and I think if we get this strike all to the floor and we have a fiscal note, that would be a good way for us to answer that, because we can have our people here in this budget office do that and let us know, you know, hey, this is going to cost the state of Mississippi this much money, because those are our taxpayers. Those are our teachers that have complained to me already. Listen, you guys, like you said, Senator Parks, our insurance costs are going up. And now we're going to say, hey, state health plan, you can no longer negotiate your pharmaceutical prices. You've got to pay this amount. Again, I don't see how that's going to lower costs, but
Again,
that's a problem.
I mean, you know, you're talking about drugs that are in a Medicaid plan. They're very comparable to what our state employs, the same issues that, I mean, in Mississippi, we have the same health issues, regardless of whether we're in the state plan or, you know, we're on the Medicare. It's diabetes, it's heart disease. You can just go on down the list. So that's the same set of drugs that you're looking at. And, you know, a lot of those patients have cancer, just like the health our state employees do. So I don't see a difference in the types of drugs. So I have to believe there's some correlation that could be made there.
The 1129 fee that you mentioned earlier, I do have some information that Ergon would, for instance, that would go from them paying 89 cents per prescription to 1129 per prescription. That's a significant increase. I heard from them also that if this bill passes, they're looking at upwards of $300,000 more on their health plan, between $150,000 and $300,000 more. And listen, we can shake our heads. I mean, I don't have the numbers, but I do know that these people have built a company that's a very large company in the state of Mississippi, and they employ a lot of our constituents. And it's something we need to be concerned with, because $300,000 is multiple jobs, multiple high-paying jobs that we're going to get rid of because.
Say to you about 1129. That's cheaper than them being charged an ER visit.
An ER, but well.
And in the event that, you know, for is getting that prescription and it, you know, and it's a whole lot cheaper, that dispensing fee is than, you know, an unmanaged diabetic. And that's a whole lot cheaper fee with their employees having access and being available.
Right. Well, you
So
mentioned ER visit.
There's, you know, there's a lot of things that we could debate and a lot of different, go off in a lot of different areas that I believe that the dispensing fee that you keep bringing up and causing our cost to rise, there's so many things that would offset that.
Yes, well, and listen, I know I mentioned some business folks. My hospital employs 4,000 people. And they're directly in this business. And since you mentioned the ER, you know, they're struggling, and we know that. We've been trying to help our hospital systems out a lot. And so it really concerns me when I get contacted from their business department and they tell me, Senator, if you pass this PBM reform, it's going to cost us a ton of money. And here we are trying to help them. And again, I don't want to say that we're not trying to help independent pharmacists, because again, I listed everything. There's only a few things that you're mentioning other than what's in HB 1665 that we're doing here. We have a PBM reform bill in front of us in the form of HB 1665. But we've been here for 3 years, and we keep coming back for every year, and we start at the point that we always start at, and we talk about negotiating, and we always end up with the same old argument that, these people show you where they're going to lose this money, and they still keep sending it to us, but it's not good enough. And then we keep with the argument that, well, hey, we want the pharmacy board to regulate this system. By the way, do you know who makes up the pharmacy board? Yeah, independent pharmacists. It would be great as an attorney if I could have the Bar Association dictate what attorneys get paid. I know that we don't do that, but that would be amazing. I think that my pay would go up. But there's reasons why we do things like that and why we build in different ways to handle this. I know I'm going on, and I'm sure everybody's also wondering why we're going on here about this, but there's a lot here. If we pass this strike all, Senator Parks, I'm worried that we're in the exact same spot we were in last year, with the exact same issues that we were in last year. I have at least requested a fiscal note. I hope properly, Mr. Attorney, to get that before we get to the floor. If there's some other procedure I need to do, I would like to know what this is going to cost the state of Mississippi, because I tried to do this last year and it was not adopted at a late moment, but we've got plenty of time here. I would like to know what this is going to cost the taxpayers, and if this is going to cost more for the teachers. So I've asked for that, but what I'm going to do instead of continuing,
You just got through talking about probably insurance is going to increase. It's increased year over year for the last 5 years. So it's going to cost the teachers more money. It's going to cost.
yeah, and I'd hate to see that.
And it's because but at least we know why. We're going to get the increase. We're going to get that.
We're going to get the
cost increase
blame
that-
if we pass this.
No, look, here's the deal. I'm going to get it. At least I will know. And at least I will know that I will have provided an avenue for care of all of the citizens of Mississippi,
How's that?
with keeping our doors open with our independent pharmacists. We've lost 55 of them, and they are what sustains a lot of our rural area and helps with our population's health.
Yeah, and listen, protectionism is something I talk against all the time in our Senate. But I'll tell you this. I know that West Virginia passed PBM reform, their version of it, and they're losing independent pharmacies like crazy. Now, I'll tell you this too. I had a bill. My bill set up a grant program. So if we wanted to just flat out say, hey guys, if we appropriate money to this, we'll help you keep your doors open. That was an option. But I don't think that we need to do it on the backs of our teachers and our policemen and our shipbuilders across this state. And I'll stop my questions, Mr. Chairman. I know that I've kind of gotten away from questions at this point anyways. I'll just speak against the amendment at the proper time.
Yes, I was going to make sure I did understand that in addition to the questions you had for Senator Parks, you also wish to speak on the bill itself.
I want to speak on the strike all, yes.
Okay. Are there any other questions or debate on the strike all amendment by Senator Parks?
Yeah.
Senator Wiggins.
I just have one question. And one of the big differences between when we were here last year and this year is Republican Congress has passed PBM reform. And that is like ERISA, this stuff is very complicated. And seems to me with Congress passing PBM reform on the federal level, And in my quick search, there's been, these things are being addressed. Last year, on the last day of session, the pharmacist got somebody to make a motion to kill the conference report in the House. If they had let it go, we wouldn't be here again and we'd have PBM reform, except that's what they did. So with congressional PBM reform that is now on the books, passed by a Republican Congress, supported by President Trump, why are we doing this now?
We're continuing. I mean, I think we all know that it's a process and that we need to continue. I believe there'll be more reform at the federal level. Very hopeful that you'll see more of that legislation in this year, if not that, that by the fourth quarter of this year. So I think it's just a continuing process. And, we have got to try to continue to increase the opportunities to keep our independent pharmacies in business and provide a healthy Mississippi.
Anyone else?
Senator Parks, the things that I've looked at, basically, I can't find any evidence out there in any of the states that enacted PBM reform where it actually increased their insurance premiums. I mean, you can search every AI generated answer. You can search every state. I can't find one place where it says that it actually increased costs. Matter of fact, it says it tends to decrease costs is what I have found in looking at different states that have enacted PBM reform. I don't understand why Mississippi would be the outlier and it would just cost us money, but it's not costing those other states money. Would you understand that, Senator Parks?
No, that's why I've repeated myself about 4 times that, we are everybody always wants to know what's happening around us. And so there are those states, and each one of them, they are saving money. They're not losing money. They have not blamed the rising cost of insurance on this reform. So thank you for your points.
And I would also follow up that what I did read in the statistics was that states that passed PBM reform had not had costs rise nearly as much as the national average, and that they felt like they were actually saving money on insurance costs with PBM reform.
That is correct, Senator.
Thank you.
Other questions? Anyone wish to speak? Seeing no one else, Senator England, you'd ask to speak on the bill itself. Senator England. I'm sorry, on the amendment.
Yes.
Senator England.
Yes, on the amendment. Thank you, Mr. Chairman. I think everyone in here understands we need PBM reform. I think that everybody in here knows that other states have done that. Other states haven't done exactly what we've done here. And in other states, I doubt that these plans were passed with literally every major employer in the state speaking up and saying, this is going to drive our costs up. We may think we know better than they do, but I don't. I think that they know better about what they're doing. We have our hospitals are asking us to not vote for this. We have other businesses. But we also have a situation where this past weekend and on the way up here, just the other day, I got a text message, hey, please vote for HB 1665 with no amendments. And I wrote back and I said, I'll look at that and I'll talk to people. I did. I made some phone calls and they said, listen, there's things in HB 1665 that we could live without. These people being the business community and others. And I said, well, our pharmacists appreciate this bill and they want to go forward with it. Can you live with it? And they said, yes. And I was so excited because we've dealt with this for 3 years and we seem right on the precipice of getting something done here. And instead of getting something done, we're right now debating a strike all that puts us right back where we were last year. And I don't think that's progress. I don't think that's negotiating in good faith. I don't know why we keep coming back with the same negotiating points and we keep talking about them, but we do. I want to just tell everyone, just so you know that HB 1665, you may not know what's in it. It's complicated, but it does a lot of things that help our independent pharmacists. There's no more underpayment through spread pricing or below cost reimbursement, and no more retroactive clawbacks. We're getting rid of that. The independent pharmacists have asked that. HB 1665 does that. Claims must be paid in 7 days, and there's interest payments if it's late. That's PBM reform. The HB 1665 does that. It creates a defined appeals process, and it correlates rates to apply for at least 90 days. That's a good thing for independent pharmacists, a great thing. That's PBM reform. There is no more steering. I can't tell you how many times I've heard people saying they don't like the steering part of this. Well, HB 1665 says, you know what, go to your independent pharmacist. You cannot steer anymore. Patients have the right to choose their pharmacist, and it prevents manipulations, and there's no punitive fees. It levels the playing field. That's what it does. That's PBM reform. There's transparency. We have clearly defined dispensing fees in HB 1665. We don't have as high of dispensing fees as what we're being asked in the strike all, but there are clearly defined dispensing fees and an ingredient fee. Deceptive spread pricing is prohibited in HB 1665. That's a big thing for independent pharmacists. They want that. We've got it in there. This is PBM reform. And there's a fair reimbursement, and there's protections to maintain a nationwide access in underserved areas. That's PBM reform. Our independent pharmacists have asked for that. The strike all does go a little further. It goes just far enough to make sure that we're all getting emails that we've gotten for the last 3 years from our businesses saying, if you pass this, you're going to cost our employees money. It's going to cost them more money. They're the end user. They're the ones that are going to the pharmacy to pick up their prescriptions. And I'm not comfortable with that. I'm certainly not comfortable with the fact that the state operates a self-insured healthcare plan. I'll say it again, the state, the taxpayer, their state has a self-insured plan, and we're told it's going to go up. I don't know why we were prevented from, why I was asked not to get or why I was not allowed to get a fiscal note last year. I have my suspicions. But why would we not want a fiscal note on this if this is going to save money? If we're trying to give teachers a pay raise, you know what I hear from them? I hear, y'all keep giving us money and my insurance costs are just going straight on up. And we're going to pass something here that I've been told by a lot of business people is going to cost money, and it's going to drive their costs up. I know that's uncomfortable. It's uncomfortable for the independent pharmacists maybe that want these last 2 or 3 points added to a bill that we keep coming back and arguing over when we have something that works here. So what my ask is of the committee is to vote against the strike all amendment. That doesn't kill the bill. It gets us right back onto HB 1665. And then we can put a reverse repealer in 1665. We can talk about this more, but let's get back to a point that we've negotiated to, and let's negotiate in good faith, and let's send something over to the other end of the hall with a reverse repealer. We can keep talking about it, but we're not putting ourselves in a position that we continually do and just keep moving this so far down the line that our business community is literally screaming at us to not do it. So I'm asking you, let's vote no on this strike all amendment. Let's get back on the regular bill, and then we can talk further. And I hope there's a reverse repealer we can get put in at that time.
Unless someone else wishes to speak, I'll recognize Senator Parks to close.
Thank you, Senator. Chairman, you know, what I would say is also in 1665, it is taking all the regulatory authority and put it under the insurance. In talking with Commissioner Cheney, you know, you're looking at 2 years for that to be put into place and to be able to regulate. So that's 2 years, 2 more years we would lose before 1665 could be even being in practice and being, so that is, to me, is a huge concern. With, you know, you're talking about your pharmacist, you know, I'm going off of the questions or their requirements that was provided to us. You know, they have 3 associations here in the state of Mississippi, and maybe even possibly more. I know there's some outliers as well. And from that, there 2 important things were, and the 2 important things we've talked about more in this bill is the reimbursement and wanting that reimbursement at NADAC plus the filling fee. You know, I would be very interested, and please ask those pharmacists that are talking with you to give me a call, because I really would like to understand more, because I want to get a bill that we can get out of here. I mean, we all do. And then, of course, as we just mentioned, the regulatory authority. So I think with the strike all amendment, we would be, granted, it appears we're going around in a circle, but this is what they have asked for year over year over year, along with the other language that you mentioned, with the spread pricing, you know, with the transparency, with the ability to audit, with the ability to, you know, take those under consideration. They have so many days before they have to make that. Those are all things, and they're in this bill. And in the strike, they're in the strike all as well. So I believe that, again, the strike all is the appropriate vehicle for us to continue with.
Vote occurs on the strike all amendment by Senator Parks. All in favor, say aye.
Aye.
All opposed, no. The chair's in doubt. All in favor, please raise your hands. All opposed? By a vote of 8 yeses, 6 noes, the amendment has been adopted. Senator England.
Thank you, Mr. Chairman. With the strike all adopted, I would like to offer an amendment to the strike all.
You're recognized.
I would like to add a reverse repealer to the bill.
Okay. You want to speak on your amendment?
Yes, absolutely. We've had very good conversations in here, and I think that even Senator Parks has mentioned that we need to keep talking about things and keep rolling. There's things we need to see. We've got a fiscal note outstanding that we need to work on, and there's just a lot of things. This is a bill that we're just now getting in front of us, and so I think a reverse repealer will make sure that we see this again and we keep working on it and make sure that we're tightening this up. I think we owe that to our folks that we represent to do that on this bill, and that's what I'll say.
Any further discussion on the reverse repealer? If not, all in favor of the reverse repealer, say aye. All opposed, no.
No.
It appears the ayes have it. The ayes have it. The reverse repealer has been adopted. Is there further debate or discussion or amendment? If not, the vote occurs on the motion title sufficient do pass as amended. I suppose it needs to be a strike all. All in favor of that motion say aye. All opposed, no. The ayes appear to have it. The ayes have it. We'll report that bill to the chamber. At this time, the chair would would entertain a motion that we rise and report progress. All in favor say aye. All opposed, no. The ayes have it. We've finished. I believe Judd A follows rapidly.